Shaquille Brewster in Missouri, Dr. Ashish Jha, Dean of Brown University School of Public Health, and Ron Insana, CNBC senior analyst and commentator. Good morning to all of you guys. So, Shaq, let's start with this booster shot. What's Pfizer saying?
Yeah. Well, Pfizer saying it plans to submit for federal authorization for a booster shot of its vaccine, citing some research saying that if taken within a third shot, if a third shot is taken within 3 or 6 to 12 months after becoming fully vaccinated, then that can provide additional immunity, especially against that Delta variant, which continues to grow and spread across the country. But overnight, the CDC and FDA releasing a joint statement touting the effectiveness of the existing vaccines that are already on the market. I'll read a little bit from their statement. They say Americans who have been fully vaccinated do not need a booster shot at this time. They say we are prepared for all booster doses if and when the science demonstrates that they are needed. You see, their primary focus is on vaccinating the unvaccinated, especially in areas like Missouri, where the Delta variant continues to spread and hospitalizations and case numbers continue to rise, targeting those who are unvaccinated. And, you know, here in Missouri, you're seeing an all hands on deck effort to vaccinate as many people as possible, including from the fire department. I had a conversation with the fire chief yesterday. Listen to what he told me about what he's seeing out in this community.
I would equate what's happening in my community right now as a mass casualty event that's happening in very slow motion. The Delta variant is spreading rapidly through our community. Certainly, we've taken aggressive measures to get us to this point through social distancing and isolations and masking. There's only so much that we can do. Now it's an individual responsibility.
He compared the need for a vaccine to the need for having a smoke alarm in your house, saying it's something you hope you never need to use, but having it can save your life. You're seeing all across the community an emphasis on having trusted members of the community get that vaccine out there. The goal to vaccinate as many people as quickly as possible. Chris?
Yeah, well, Dr. Jha, let me go back to the booster. The FDA, CDC obviously pushing back that they're not alone. Some critics have been, frankly, pretty blunt. They say this makes Pfizer look opportunistic, that it's money-making, not science-based or a health-based venture. What's your take on this?
Yeah, so Chris, thanks for having me back. The way I look at this is we've got to be guided by evidence and science, right? And so far, the data says that 2 shots of the vaccine, being fully vaccinated, offers a very, very high degree of protection. So what I want to see is what is the data that Pfizer is basing its recommendations on? But all the evidence and all the data so far says 2 shots is more than good enough. Everybody does need to get 2 shots. And obviously, if new data comes out that says we need a booster, I think we're all going to want to reevaluate that. But right now, I haven't seen anything that makes me think a 3rd shot is necessary.
So obviously, part of the argument for the booster includes that efficacy may wane after just 6 months. Vaccination drives are slow. Reopenings are fast. And then there's also this French study I want to ask you about in the journal Nature, concluding that the Delta variant can partly sidestep your body's immune response. If this is an abundance of caution development, both the booster and a Delta-specific vaccine, is there a danger?
No, I wouldn't say there's a danger. What I want to do, though, is, I want us to really be guided by what the evidence says about infection. So we could look at antibody levels. We can look at lots of different metrics. At the end of the day, the question is, are fully vaccinated people getting infected at a high rate? And if they are they getting sick? And if the answer to those 2 questions is no, and that's what we've seen so far, then I think we just keep going with focusing on getting more people vaccinated. If obviously the answer changes, then we want to change our approach. But right now, I haven't seen the evidence that makes me want to do things any differently.
Obviously, we're trying to get this big push to get people who aren't vaccinated. But what about testing? Because certainly it seems like a New York City, I see these testing centers set up. I haven't seen anybody at them. Do we need, if we're going to know about variants and their spread, do we need to do more testing?
Absolutely. I actually think this is one area where we have kind of let the foot off the pedal because, again, we had vaccines and we thought, boy, we're going to be over this pandemic. But as we're starting to see increases, I think we need more testing, certainly in unvaccinated areas. That's going to be really important. But I also have been pushing for, and I believe that even in highly vaccinated areas, we are going to see breakthrough infections. We want to catch those early. We want to know who's having breakthroughs, how often they're having. None of that is going to happen without testing. Some of it is in these testing sites. A lot of it is also going to have to be at-home testing, and we've got to make that much more readily available.